One of the most common questions I get from consultees is how can I begin introducing EMDR to my clients? How can I introduce this in the office, perhaps to clients that have been in talk therapy for a while? So I'm going to share with you how I talk with clients about EMDR. There are many ways, this is just one of them. So I begin typically by giving a little bit of education about the neurobiology of trauma and explaining the theory of the triune brain by Paul MacLean. You may have a model of the brain in your office, or you can also use your hand curled up like this to show a brain. And I explain that at the base of the brain, near the spine, we have the reptilian complex that's in charge of our survival and our instinct. Then layered on top of that, we have the limbic system, which is the emotional area of the brain. And then on top of that, just common to humans and primates, we have the neocortex, our thinking, language, logic area of the brain. So what is the relevance of this when it comes to trauma? When we experience an adverse event or some kind of a trauma, this gets held in the limbic system out of the reach of the neocortex, out of the reach of the thinking brain. The brain does this for its survival so that next time we encounter a threat of some sort, we can respond all that more quickly to what is going on in our environment. This is what ends up essentially creating the symptoms of PTSD and triggers. So how can EMDR help with this? Well, in EMDR therapy, we use bilateral stimulation to reorganize the way that the information is held in the brain and to reprocess that information. So bilateral stimulation is any movement left, right, left, right. Sometimes I might say to my clients, have you ever felt better after taking a walk or going for a run? This is why we're bilaterally stimulating the brain. You may have also noticed sometimes when people sleep, you can see their eyes moving back and forth underneath their eyelids, showing they're in REM sleep, which is this organizational part of our sleep pattern where the same process is happening in the brain. So if I'm at the office, I will show my tappers. You may have technology, or you may use your hands to bilaterally stimulate for EMDR in the office. And I explain that the tappers assist the brain in moving in this way so that we're essentially moving where the trauma is held in the brain. It's moving from the emotional area of the brain where we have these visceral reactions up to the thinking area of the brain where we have access to language, logic, perception, and a sense of time. So in other words, we're still going to remember what happened, but it won't be in such a charged way. I hope that's helpful in beginning to explain EMDR to your clients.